Well, good morning, everybody. Hi. I get to see who all's here. My name's Adrienne Miles, and I want to welcome you to the very first remote Facebook Live class at Southern Hills Hospital. Thank you for all of you who signed up, and I'm hoping that this will be a really good learning experience for everybody. It's different time, different circumstances, so this is a first for me, so we're just going to keep things casual, and I want you guys to feel free and post if you have a question. I'll take some time about maybe halfway through the presentation, and we'll talk about, we'll try and address some of the common questions, but in a real class, I'd have you just raise your hand, but here you're just going to type your question and put it in, and I've got a helper here named Cindy that's going to let me know when we've got some questions. If anybody's having trouble with the tech portion of it, if you can't see, if you can't hear anything, or if you're having trouble finding the link, or you have a friend that's having trouble, just post something and we'll try and address that as well, okay? Hi, Joe. All right, let me see your question. Is it really hard to breastfeed with flat inverted nipples? We will get to that. The short answer is no, sometimes. That's what I'll say for now. There's things that we'll do for a patient, and it's kind of on a case-by-case basis. Not everybody who has that particular challenge necessarily needs a lot of interventions, but we'll talk about that, okay? As you guys log in and you start watching, give a shout out to yourselves or to the rest of the group and say, hey, this is so-and-so, tell me where you're from. I'm sure we've got a lot of people from Vegas. And I know there's one lady in University Place, Washington, who's watching, Kathy Keltman. Hi, Mom. Hi. I'm sure you're going to get a lot out of this, so be sure and pay attention and take good notes, okay? All right, everybody. So in the real-time class, we start out by I would introduce myself and talk to you a little bit about my experience as a new mom with breastfeeding. So we're just going to kind of follow my outline, and we'll just kind of go from there. Hi, Yvette. All right. So first of all, professionally, I've been a nurse for almost 8 years, and I've been a lactation counselor for about 6 of those years. And it's something that I wanted to be more of a help to my patients. I knew that there was more I could do, and I wanted to be more of a help to them. So I class, and I loved it, and I've been just helping out ever since. I've been always a postpartum nurse. When I was in school 10 years ago, 12 years ago, I knew right away that this was the land I wanted to be in, and mother baby, and it's where I plan to stay until it's time for me to stop working altogether. And I've been at Southern Hills Hospital my entire postpartum career. When I was a student in nursing school, I was very fortunate. I got to come here and do my preceptorship, which is something you do in the last semester of your nursing school experience. And the minute I walked onto the unit, I felt so at home. I loved the colleagues that I got to work with, and a lot of them are still here, and I still work with them now as a professional nurse, and it's just a great place to be. I love it here. I love the hospital, and I love my unit so much. So as a mom, when I went into motherhood, I knew a lot about newborns. I had taken care of children a lot, but when you have your own baby for the first time, it's a whole different ballgame. And when I had my first baby, she had to go immediately to the NICU for about 2 weeks. And the first time I got to lay eyes on her, she was 4 days old. So all the classes and the books that you read will probably talk about the importance of skin to skin and getting that first breastfeeding session in within the first 2 hours. We call it the golden hour sometimes in some hospitals. And I didn't get that. What I did get was a nurse who came to me, I think it was maybe my 4th or 5th day. I know I had been out of bed. And I know I had been to see my baby at least once. And she came into the room, and she had some stuff in her hands. I didn't know what it was. And she said, here's breast pump. You should probably use that. And then she left. And I thought, what? Okay. So I started fiddling around with the parts and figured out how to use the breast pump. And when my daughter was about a week old, I started having a lot of difficulty with soreness. I wasn't sure if I was doing it right. And so my mom said, because she was staying with me, maybe there's someone at the hospital that can come and help you with. Oh, okay. So when my nurse came in and asked me if there was anything I needed, I said, well, is there a lactation person here? Well, yes, there is. She's here today. So she came and helped me tweak my positioning a little bit, and then we were off to the races. And the time that she was in the NICU, I wasn't there, so that they were feeding her. They're not going to just starve her, right? So my daughter had bottles for the first 4 days, and we successfully breastfed for over 6 months. And that was 22 years ago. And then about 18 months later, I had another child. I had my first boy. And when I had him, it was the end of the summer. And when I went back to work, I was working retail at this point in my life. This is almost 21 years ago. And the environment that I was in wasn't super supportive to breastfeeding moms, not at all like it is now. So many of you guys are so fortunate. You're able to go to work and your bosses know what your plan is and they make arrangements. But back then, not so much. So I didn't breastfeed very long. With my son, but I don't feel any less bonded to him. And I always tell moms, it doesn't really matter how long, it's as long as it works for you and your baby, and some is better than none, right? Then I had my third son, and everything was great. I had a wonderful pregnancy, and again, another successful breastfeeding experience. But it had been a couple years. I still needed a refresher, kind of. So I did ask one of the nurses at the hospital to come and just check and make sure I was doing everything okay, and I was. So now,
you want to answer some questions?
Sure, yeah, let's answer some questions.
So when your baby starts to get teeth, how do you stop them from biting? This question's from Denise.
Oh, Denise, that's a very good question. So babies are usually at that point, around 5, 6, 7 months old, depends. But what you can do, you want to make a point, let them know that that's not okay. So what I did, this happened one time, and I won't say which baby, just in case they might watch later. So one time, the baby bit me, and I went, nope, and I just tapped him on the nose, and then I broke the latch, distracted them, and then we went back to feeding. For most babies that works, you might have to do it a few times. Some babies are really clever and they think that it's a fun game. If I do this, mommy makes this sound and she makes this funny face. And we don't want them to think it's a game. So you want to say no, get their attention some way, tap them on the nose, break the latch, distract them, and then come back to breastfeeding.
Let's do
Try
one
that.
more and then we'll continue.
Okay, one more question.
So Sharon, any tips how to keep the milk supply when you go back to work, storing and schedule? She's had a setback with those issues before.
Oh, yes, and that's something we're going to address that towards the end of the time. That's a really good question, Sharon. Yes, there are lots of things you can do, and we will get to that towards the end of the presentation. So hang tight, we'll address that in a little more detail. But yes, there's things you can do. Any other questions?
Yes, we have one from Martha Ocampo. If you are a size 36 double D, is it harder for a baby to latch to your breast since they do get big?
No. And I should qualify that. The short answer is really no, but babies will latch. It doesn't really, the size of the breast doesn't really have as much to do with it as you might think. Some moms think, oh my gosh, I'm not going to be able to see the baby's head. They're going to suffocate. There's ways to do that. And you just tweak your positioning. That's all. But a mom with a chest measurement like that with maybe a 5.5, 6 pound baby, absolutely they can do it. You might not position your baby in the same way that a woman who's got maybe a smaller chest size with a larger baby would position their baby, but there's ways to do it. It can be done.
Do you want to keep with questions or continue on?
Let's do one more question and then we'll continue.
If you want to repeat the question just in case they can't hear.
Okay.
So this is from Amy. Hi guys, my question is, can you switch to breastfeeding if you've been exclusively breast pumping for a few weeks?
So the question is, can you switch to feeding at the breast when you've just been exclusively pumping? Yeah, you might have a challenge because your baby might be accustomed to the nipple that's on a bottle rather than your physiology, but that can be accomplished. Just get some help if you have trouble, but yeah, that can be done. All right. Okay. So we'll break in just a little bit, a few more minutes, and we'll talk some more and answer some more questions, okay? I'm going to just check my outline here and see where we are. Okay. So the whole point of having the class here or in real time is because you want to breastfeed your baby. Most of the time, parents have done some, if not a lot, of research, and they know some of the good things about breastfeeding, maybe not all the things, or maybe they're just doing it because their friends said, oh, this is great, a lot cheaper. So what I ask the group is, what have you heard about breastfeeding? What have you guys heard that makes it so wonderful, and maybe why are you choosing to do this? And if you want to just put your comments up, that's fine. We're going to talk about the benefits to the baby first, benefits to mom, and then some other benefits that people don't necessarily think about. So when you breastfeed, your baby gets a perfectly balanced meal at every single feeding. And formula can't do that. They've tried really hard, and they've done a pretty good job of trying to mimic things as best they can, but bottom line, there's just no replacement for breast milk. So the nice thing about breastfeeding too is that every time you're breastfeeding, the components of the milk are exactly what the baby needs for that feeding at time. And especially in early days when you're first breastfeeding and you start with your colostrum, think of that as your baby's first vaccinations. Because what you're doing by breastfeeding, especially, but also providing your baby with passive immunity to any kind of virus or infection that you may have been exposed to. So all those shots you got as a kid, now they're going to pay off. Your baby won't be able to get, for instance, the measles, mumps, rubella vaccine until they're at least a year old. But if you've been vaccinated, you're immune, and every time you breastfeed, you're going to pass that immunity along to your baby. Some other important things about breastfeeding, that when you especially do provide colostrum and then continue with breastfeeding, it helps to lay down a really good foundation for the baby's immune system. Well, I wouldn't say most, a lot of people know that the majority of our immune system is right here in our gut. And if you have all that good colostrum and then followed by really good breast milk, you're in a really good foundation for your baby's immune system. And that's a big part of the reason why babies who are breastfed have ear infections. They just aren't sick much. And I can attest to that. All three of my kids, we had a pretty easy time when they were little, and they were at daycare a lot, but they didn't get a lot of colds. I can count on one hand the number of times each of them had an ear infection, and I didn't really miss very much work. I was working full time, and it made a big difference. What are some other things that are good? When your baby's teeth start to come in, the teeth are going to come in, and they're going to be in a better position versus someone who is just using formula feeding. Plus, the skeleton is going to be stronger and teeth bone, so your teeth are going to be stronger as well. I'm going to refer my notes because there's a lot of stuff and I don't want to forget.
People if we're having audio issues.
Okay. Is anybody having any audio issues? Anybody having any trouble hearing? I just want to do a quick tech check. If you are, just make a comment. Okay. We good? Okay. All right. We talked about preventing illnesses and the beneficial gut bacteria for the baby. Babies that are breastfed have fewer allergies. Also true in my case. Okay, we're gonna just a second. We're gonna try and fix audio issues. So just bear with us.
By
This is
Thank you so much for joining. We're checking audio right now. It looks good, right?
Yep.
Okay. Thank you for bearing with us, you guys. Yes, repeat questions too.
Gotcha. Okay. So.
Okay. Hopefully, I'll keep monitoring it, but.
Okay. All right, Asia. Yes, I got your comment there. I'm going to repeat the questions now, again, just to make sure everybody can hear. Okay. All right. So we were talking about the benefits of breastfeeding for your baby. Fewer ear infections, allergies, fewer GI issues. They have less issues with their skin, their respiratory system, fewer intestinal infections. They also have a lowered risk of diabetes, a lowered risk of obesity later in life, or just problems with their weight. They also have a greatly reduced chance of dying from SIDS and far less issues with tooth decay. And the tooth decay part comes back in the I don't think people are doing this so much now, but with bottle-fed babies, a lot of times they would be put to bed with a bottle and the milk just kind of sits in the mouth, and that's where they saw a lot of the tooth decay coming from. Now, let's talk about benefits to you, Mom, okay? Because you're getting something out of this too, right? So, of course, we know about the unique bond that you can develop with your baby by breastfeeding. They're just close to you, and you have a chance to really establish that relationship with as a newborn. You're also going to lose weight easier. Everybody loves that. I know I appreciated that a lot. It was really nice. And then as soon as you stop breastfeeding, you realize, oh yeah, I have to change my diet. I'm not a milk factory anymore. I don't need quite so many calories. That can be a little more challenging. You're also going to have a lowered risk of breast and certain types of ovarian cancers, lower chance of osteoporosis, heart disease, and then you're going to reduce your chances of becoming obese later in life as well. And then at this point in the class, I try and include the dads. We have a lot of couples or partners that come, and they're not going to be breastfeeding, so they're not going to be actually doing the work, but there's benefits to them as well that they don't always think about. So it's going to save a lot of time and a lot of money. You're going to be saving approximately $2,400 a year in purchasing formula, and then you have the bottles and all the other equipment that goes with bottle feeding, plus the time that's involved. You have to make the bottle, you have to make the right amount, and then if the baby's still hungry, you've got to put the baby down and go make some more. Whereas if you're just breastfeeding, everything's right here. And it's already at the perfect temperature. You don't have to sterilize it. Your baby's going to get exactly what they need, and constantly producing. Everybody, make sense to everybody?
Do you want to answer a few questions?
Yeah.
We are rolling in, so let me...
Okay, we're getting a bunch of questions, so we're going to take a break and answer a few.
If you want to repeat the question too.
Yes.
How can you tell, this is from Jenna, how can you tell if your baby is cluster feeding or comfort feeding during those middle of the night feeds?
Jenna, that's a good question. So Jenna's wanting to know, how can you tell if your baby's cluster feeding versus just comfort feeding? Well, cluster feeding tends to happen a little more in the beginning. We see it anywhere around 24 hours after delivery, and then again about 10 days. It usually indicates the baby's going through a growth spurt. It doesn't last very long, and you just want to hunker down and just get through it.
All right, so Chelsea and this might be a complicated answer.
Okay.
Chelsea is wondering, can you please go over the appropriate breastfeeding diet, maybe do's and don'ts?
Chelsea wants to know about the appropriate breastfeeding diet, do's and don'ts. Really easy. You're going to just eat a really healthy, well-balanced diet. If you are a vegetarian or a vegan, you want to be careful to be sure that you're getting complete proteins, and you want to be sure that you're getting all of your B vitamins, because when you take meat out of a diet, you tend to have a drop in the amount of the B vitamins in your system. You also want to be sure that you're not getting anemic. So be sure that you're eating a very healthy, well-balanced diet. All the things that you were told during pregnancy that you can't eat anymore, like sandwiches from Subway, sushi, all bets are off. You can have all those things. So you just want to practice moderation. You're probably going to want to have a brownie. Don't have the whole pan. Have a brownie. Have a dish of ice cream. Have some chips. Have some popcorn. It's fine to incorporate all those comfort, snacky foods that we love to eat. Just remember that what you're eating is eventually going to be manufactured into breast milk. So you want to make quality milk for your baby, right? So try not to rely on those quick, convenient foods. Try and get plenty of fruits and vegetables in your diet, complex carbohydrates, be sure you're getting enough protein. And everybody who is breastfeeding knows or has breastfed knows now that breastfeeding is really thirsty work. So you want to be sure you're getting enough fluids. 3 to 4 liters of fluids is good. Just to maintain, you want to get your thirst, but you want to be sure that you stay hydrated yourself. So 3 to 4 liters. It doesn't all have to be water. It can be, add some juices, add some fresh fruits to the water, whatever you want to do. I'll just go ahead. I'm guessing someone's going to want to know about coffee. Coffee is okay. What I have told moms before is when you run through Starbucks, instead of getting a non-fat latte, get it with whole milk. Your body could use a little extra fat, which reminds me, when you're composing your healthy diet, you want to be sure you're getting enough healthy fats. So avocados, cashews, things like that, nuts, don't have too many, but those have a lot of the really good fats that we need in our diet.
Let's do one more question and then we'll go on. Is
Okay.
that okay?
Yeah, we'll do one more question and then we're going to keep going on. Oh, Raquel Bassing, I see that. She says we're losing audio a bit.
Okay. You can tell them we're trying hardwire in.
Okay. All right.
All right, so let's answer a question from Kelly.
Okay.
Kelly says, I didn't produce enough milk with my firstborn. I'm 35 weeks now and have noticed my milk is in already. Will that give me a better chance this time around?
Kelly, that's a great question. So Kelly said that she had difficulty with the first baby, and now she's starting to leak at 35 weeks. That's very normal, and we would expect that to be happening about this stage in your pregnancy. So that, yeah, that's a good sign. It really helps that your body's been through this process already once. So your body, think of it sort of like muscle memory, but on a hormonal level, if that makes sense. So your body's gone through this process once before, and it knows what to do. So the way to make sure that you have a really good supply is to be sure that you're breastfeeding a minimum of 8 times every 24 hours from the moment the baby's born, and just keep going from there. That being said, breastfeeding is all about supply and demand. As the demand goes up, the supply will go up to match it. So if you have a baby that's eating 6 times a day, which may be okay for that baby if they've got enough output as far as wet and poopy diapers, and the pediatrician's happy with how they're growing and they're meeting their milestones, then 6 feedings could be perfectly fine. Some babies need 12, which is about every 2 hours, which can be exhausting, but you want to take each baby, don't try not to let your previous experience color what you're doing with this baby now. Just be sure you're feeding your baby often, be sure you're getting a good latch, be sure you're doing that at least 8 times every 24 hours, and you should be okay with supply. And I'm seeing Chelsea's got another question. Oh, it just went away. Can you go over the we talked about the, okay, Chelsea, I see we already answered your question, but
Answer another one?
Cindy's telling me we've got a bunch more questions, so I will answer one more and then let's keep going.
Ivy says, when I breastfed my baby, when I breastfeed my baby, should I be pumping the other breast at the same time and then switch, or I pump after?
So, what's Ivy? Ivy, that's a good question. So, no, the short answer is you don't need to pump simultaneously. If you have the baby latched well on the left side and they're still hungry, just put them on the right side, and then when you start the next feeding, start with the right side, because that side will probably have a little milk, a little bit more in it, and then you'll just go back and forth like that. You want to be careful not to pump every single time while you're feeding. Get into a situation where you have too much supply, oversupply, because that can be really uncomfortable. But if you find that you're leaking, there is a little, and some of you moms that know about this, if you can remember the name of this little contraption, post it. I would love it. I can't remember the name of it, but it's a little silicone, kind of an oval-shaped piece of equipment. You squeeze all the air out of it, and it has a part that fits against your breast. And as you collapse the air out, it gently provides suction. So while you're feeding on one side, you can catch whatever the drips are, whatever's leaking on the other side, so you can save that for maybe a supplementary feeding next time. So if anybody knows the name of that, put it up there. I can't remember it. Okay, I'm going to go. And okay, are we still having issues with audio? We're going to try and harder in everybody, so bear with us. Melissa, I see that sound spotty still, and now we're picking up again.
Let's just continue and then we'll kind of go in and out.
Okay.
We're working to hardwire in though.
Okay. All right. So we'll just hang with us. We're going to try and get that audio fixed, okay? So I want to move on now to, we talked enough about the benefits to you, to the baby, and to the rest of the household. So what I want to talk about now is for you first-time moms, I want you to know what the process is going to be like when you come to Southern Hills Hospital. And you'll probably find it's pretty similar to other hospitals as well in general. So hopefully by the time you come to the hospital for your induction, or if you have a scheduled C-section or you're in labor, you've already pre-registered. So be sure you pre-register, and if you're going to deliver at Southern Hills, that's something you want to do a month at least out from your delivery time. So the days come, you're in labor, you're here for your induction, you're for your C-section. You're going to come up to the desk, and one wonderful unit clerk is going to get you registered, and then we're going to walk you down to delivery. You're going to go through the process, however your delivery is going to happen. At the end of it, you're going to get a baby, right? So the first thing you want to do after that baby's delivered is put the baby skin to skin. And that means just exactly what it sounds like. You've got a new naked baby right here on mama's naked chest. They're going to dry off the baby, and they're going to be needing to get vital signs, make sure your baby's breathing well, make sure the heart rate's appropriate. Usually we'll be giving the first vaccines during that time. If you want your baby bath, you'll do that in the first couple hours. But for the first half hour to an hour or so, if you can put that baby skin to skin, that will be so helpful.
People were saying the haka.
Thank you, haka. I knew it. That piece of equipment I was talking about is a haka. And I know you can get it on Amazon Prime because I've looked for it. Now, I want to show you guys what skin to skin looks like. I've got a little prop here, and this baby is pretty well true to size. I would say maybe 17 inches long, looks to be about 5-ish, 6-ish pounds, give or take. And bear with me, I'm going to move this baby's head and stuff into position. So when you do skin to skin, you want to put your baby just like this. Now, can you guys all see that? The baby's head is turned so the nose and mouth clear, and the ear is pressed right against my heart. And you're going to be laying back in bed. You're going to hold your baby. You're going to talk to your baby. We're going to have the baby covered with a blanket, right? Because we don't want the baby to get cold. Just like this. In a perfect world, for me anyway, this is how all babies should be. This is where they should be at all times, except for when the mom needs to go to the bathroom, take a shower, eat. Baby should just hang out here. If the mom is sleeping, of course, we want the baby to be on a firm mattress like this crib here, always on the back to sleep as well. So skin to skin does a lot of things. It helps to increase your breastfeeding hormones. One hormone tells your body to make the milk. The other hormone tells your body to send the milk out to the baby. It tells the milk ducts to contract and to release that milk and send it out through your nipple pores. Skin to skin really helps a lot with that. also is going to help your baby's vital signs to remain more stable. They have much better respirations. Their heart rate remains steady and regular. They're also going to maintain steady and even blood sugars. Sometimes babies are born and we're checking their blood sugars for various reasons. Those babies especially should be skin to skin, because the skin to skin really helps those blood sugars to remain stable, and you need fewer interventions that way. So when you get ready to do the first feeding, you're going to be looking for some behaviors with your baby, and we call these feeding cues. You'll probably read about those in some of your breastfeeding books. So what are the feeding cues? Well, babies can be kind of just looking around like this, kind of pecking around looking for the breast. They could be rooting, which is, opening their mouth wide and turning toward the breast. This is instinctive for them. They might be putting their hands in their mouth, licking and smacking, and all of those are the early feeding cues. That's when you want to get your baby latched. If your baby hasn't fed in maybe 2.5, 3 hours and it's crying, that's more of a late cue. So what your baby's telling you is, hey, I was trying to tell you I was hungry before and you didn't really pick up on it, so now I'm really going to make my feelings known. That's when you want to get your baby latched. Try and catch those early feeding cues. Cindy, do we need to maybe stop and answer a couple questions?
So you mentioned skin-to-skin contact.
Mm-hmm.
Victoria would like to know, should the father do skin-to-skin also?
Victoria, that's a great question. Yes, dads should do skin-to-skin if that's not every dad is, and that's okay. But even if your partner isn't doing strict skin-to-skin, there is something about the lower pitch of the daddy's voice. When that baby is up here, if they've been crying, dads have their own unique kind of mojo, and they really can help that baby calm down. I've seen it happen so many times. Baby is so messy, and the mom's been trying so hard, and she's just exhausted, and we hand the baby over to dad, and the baby just instant calm.
We're going to try and hardwire in if you want to let them know.
Okay.
Might have connectivity issues.
So I want to let you guys know another little tech update. They're going to try and hardwire in. So we might have a little bit of issues with that, so bear with us. We might have a little bit of connectivity issues.
Right.
So I'm going to pause for just a couple minutes while we let Miguel do his thing.
Cancels, we'll restart anyway.
Okay? If it happens to cancel, stick around. We'll just restart the event. Okay? Thanks, everybody, for bearing with us.
You're still live.
So get a thumbs up. That's awesome. Okay.
Yeah, we're still live.
All right.
You want to answer another question?
I'll answer another question. If you guys want to hit your applause emoji for Miguel, thank you very much, Miguel, for fixing that for us so we can finish this up.
So,
Let's answer one more question and then we'll keep going.
Brittany would like to know, if baby feeds on one side and then is asleep or seems full, should you pump on the other side or just start on that side next feed?
Okay, Brittany, that's a good question. So what she's asking is, if she's fed her baby on one side and the baby's fallen asleep, should she pump on the other side or just latch the baby on the side? The answer is put your baby on the other side. Ideally, just have the baby doing all the milk extraction. The baby is the best extra of milk. The baby press the milk ducts inside the breast and provide the suction, whereas pump only does the suction. It doesn't do a very good job of compressing. That being said, if that's something you want to do, if you're planning to save whatever you pump off the other side, absolutely you can do that. And then I would still, on the next feeding, put the baby on the other side, because your body is going to continue to produce. Does that make sense? Let me know if I need to clarify that again. Okay. So we talked about positioning, we talked about skin to skin, we talked about how, yes, dads partners should be doing skin to skin as well if that's something they're comfortable with. Now, I want to talk about positioning because this is where I see patients running into the most difficulties. And tweaking the positioning a little, it can make all the difference in the world. Sometimes you just need just a little tweaking in how the baby's breast or how the mom's supporting her breast. Oh, thanks, Kelly. You're telling me awesome. We've got good audio now. Good. Okay, so for this baby, what I'm going to show you first is the cross cradle hold, okay? So with cross cradle, I'm going to pretend to latch the baby on this side. So I'm going to hold the baby with my right hand, okay? This is my left, this is my right. I'm going to put my arm right along mine. Now see where the heel of my hand is here, right by the shoulders, and I'm going to put my fingers right behind the ears. This is a really strong part of the baby. So you're not going to hurt your baby, but you want to be able to firmly that baby's head because they need this kind of help. They need this support to maintain the latch, okay? So what you're going to do is get your baby in this position, and it might be kind of hard, so try and modify a little bit. So what we want is the ear and the shoulder and the hip to be in a nice straight line, and we want the whole body turned toward the baby. In other words, you don't want to do this. The baby's head is turned toward me, but the rest of the body is out here. And some people might wonder, well, does that really make a difference? Yeah, it does. If you're sitting, wherever you're sitting, I want you to turn your head, try and swallow. Okay, now turn with your head facing one direction. Now try and swallow. It's a lot easier when everything's facing the same direction, right? I think we've got a question.
So it sounds like audio is still going in and out. I wonder if
Okay.
you should just use the audio from the computer, or would that mess it up?
Still having some audio issues. We're going to try and work through that. Thanks for bearing with us, everybody. Hi, Debbie. Thanks for joining us. You guys wave to Debbie Van Duzzy Hernland. She's our full-time breastfeeding consultant. She's here to help with lactation. She's taken a little bit of time off. We've got her on furlough right now just for a couple weeks, but as soon as she's back, she's going to be in the room. She does a great job. So if you guys are needing a lot of one-on-one assistance or you want to talk with her, look her up. She'll be back here in the hospital soon, so in the meantime, we're going to help you guys out as well. Okay, so that's kind of what this class is going to be. We're going to give you guys the information you need, so when you come in, you'll have some of the tools you need. That said, he also has a warm line, so if you've got questions after you've delivered, you can call the main number, and I'm going to give you that number now, and then we'll repeat it again later. This is for the main desk for women's services at Southern Hills. It's area code 702-916-6600. And Cindy, if you want to put that up too, so that if people aren't hearing me, at least you can see it in the message there. So call the number if you've got questions, and we'll try and help you out as best we can, okay? All right, so let's get back to positioning. So we're going to support the baby's head behind the ears. Can you guys see right there? I'm putting my thumb, and I use, on this baby, it's small enough I can use my finger, but you might be more comfortable with 2 fingers there. You're going to bring the baby right up against you like this, and then you're going to use this hand, and you're going to support your breast like this. A lot of moms want to try and do this, and sometimes your thumb and your fingers can get in the way, so think of it as putting your fingers right where the bottom part of the cup of your bra would be. That's where you want your fingers to be, way back here against your rib cage, okay? So maybe try and practice that. So take your hand, I'll tell mom to make an L, and then just kind of scoop under, just like that, okay? I'm sure some of you, if not all of you, have a breastfeeding pillow. That's wonderful, especially when you're sitting or lying back. You're going to want some support, okay? So we have pillows here at the hospital that you can use if you don't have one, or if the one you bought you left at home. So let me go grab that, okay? This pillow might look kind of funky to some of you. This is called the My Breast Friend. My Breast Friend, B-R-E-S-T, friend. You can get these on Amazon, and the price runs anywhere from $23 to about $40. Depends on who you purchase from and what kind of cover and how fancy you want it to be. The way this works is you're going to put it around you like so, and this part of the pillow acts like a shelf for the baby. Now I want you to notice, do you see where I've got the pillow? It's way up here, right underneath my breast. And that's because you want the baby up at the level of your breast. You don't want the pillow down here. What you'll wind up doing, let's get this back here. If your pillow's way down here, let's say you're sitting in your chair at home or on the couch. If your pillow's down here, you're going to find yourself leaning over and you're bringing the breast to the baby. That's what you want to do instead. Have the baby all the way up here, and you want to bring the baby to the breast like this, okay? And I realize these arms aren't really, this isn't the best position, but this is where you want the breastfeeding pillow to be. Here in the hospital, what we recommend is taking one of your bed pillows and putting it right underneath. And that helps to keep the My Breast Friend pillow up where it needs to be. Now, you see here, there's a little strap. I didn't connect, but this will wrap around, and you can tighten this or loosen this as you need to for your own body. But this will help keep it in place, but this is not going to probably be enough support, especially as your baby gets bigger. So either get a pillow from the couch, from the chair, take an extra one from your bed, whatever you want to do, and put an extra pillow underneath your breastfeeding pillow. It's really going to save your upper back muscles in the long run.
Should you have a support pillow in your hospital go bag?
Okay, so those of you, what's her name again?
Angelique.
Yes, you want to bring your breastfeeding pillow. We have a limited number of these, and as you can see, we aren't going to send them home. They belong to the hospital. If you have one, bring it. Yes, absolutely. It will help you tremendously. Not that the bed pillows that we have here will help to a certain point, but they don't have the nice firm support that the My Breast Friend pillow has. If you've got a boppy, bring that, and we'll show you how to use that and get your baby in a good position as well. Okay, now there's one other hold that I want you guys to know about, and then we're going to move on to the next section of the class. So cross cradle is this way, and then supporting the breast like this. Now, some women find if they've had a C-section, you don't want to put a lot of pressure right on the belly, and that was my situation. All three of my babies were C-section, and it was uncomfortable doing this. So what you might find helpful is to use the football position, and you're going to hold the baby the same way, but instead of feeding over here and supporting the breast over here, we're going to just scooch around here, and you're going to hold it like a football, okay? Now, what do you do with this hand? You're going to go like this. And again, your thumb and index finger, you're going to find the underside cup of the bra. Maybe to Now, it's going to be really hard for me to demonstrate the asymmetric latch. So what I want you guys to do is there's a gentleman, his name is Dr. Jack Newman. And I'll have Cindy put that up in the comment section too. N-E-W-M-A-N. Dr. Jack Newman is a pediatrician, and he's opened several breastfeeding clinics up in Canada, and I believe a couple places in Africa as well. He has a wonderful video, and that video about breastfeeding has wonderful up-close images so that you can see exactly what an asymmetric latch is going to look like. Miguel, you're getting lots of applause.
So there was one question.
One more question.
It was about the boppy. Pros and cons of a boppy versus breast friend.
Oh, okay, sure. We can go over.
From Cassidy.
Oh, Cassidy, you want to know about the pros and cons of the My Breast Friend versus the boppy. So the boppy is great because it's multifunctional. You can use it for, that's what I had. You can use it for support for your arm and for the baby when you're breastfeeding, and you can get it up nice and close to your body, which is what you need to do. But you can use that for things other than breastfeeding. As your baby gets a little bit bigger, if they want to sit, you can kind of plunk them inside, and that can help support them, of course, with someone watching them. But sometimes it's just nice to have an extra place to put your arm when you're doing regular regular cradle hold when you're breastfeeding. So it's multifunctional. The cons of the boppy is that it tends to move, and it's harder to get it into that nice sweet spot. The other thing to remember too is that the boppy is preformed, and it's one shape, and that's it. So if your rib cage happens to fit, great, you can use that. That's awesome. Mine didn't fit so well because I'm a little bit broader in my rib cage. And if you guys haven't noticed this, you will shortly. Your rib cage tends to expand a little bit when you're pregnant just because your body's trying to support the growing baby, right? Well, your rib cage doesn't always go back to its original shape. So you may find that, and this is just a little aside about bra fitting, you may find that before you were pregnant, if you were, say, a 36C, you might be a 38D or double D. You might just have to increase the bandwidth of your bras even after you're done breastfeeding. So keep that in mind. Don't be surprised if that happens to you.
I missed a question from Nikita.
Okay, Nikita, we've got a question from you.
Baby is showing she had a question when you were talking about skin to skin. If
Okay.
baby is showing those feeding cues during the first skin to skin, do you feed before the baby gets his shots and cleaned off and everything?
So, yes, Nikita, if your baby is showing those feeding cues, feed your baby. Feed your baby. And we can work around. If the baby's being breastfed and we've got that one little leg up there that's out, we can give the injections. Babies that are breastfeeding, they're going to perceive less pain because they're sucking. And we know that non-nutritive sucking helps. So why not make it nutritive? Let your baby eat. And they're right there. They can be soothed and fed and comforted all at once. But yeah, we can work around that. Now, do we want to get done in a fairly timely manner? Yes, but we're not going to be pushing our agenda on you to the detriment of feeding. That answers your question.
Do you want to answer more? Or can we...
Let's do one more. Well, I want to finish answering, I think it was Ivy that had the question about the pros and cons of the two pillows, or maybe Cass. Anyway, so we talked about the boppy. So my breast friend, I would say the one is that it's single purpose. It's for breastfeeding only. But the pros to the breast friend is that, and I'll show you here, this strap right here is adjustable. So if you happen to have a narrower torso and you just need that much, well then you're going to tighten this right here pretty well. But if you're a little more generously figured woman like myself, then you can adjust this out and make more room for yourself. The other nice thing about this pillow is this piece right here, that goes against your back, and that provides a lot of excellent postural support. It's very easy to start breastfeeding, and before you know it, you're in this habit of you're kind of hunched over. And it really wears on your back. I remember standing up and just so stiff, and I needed to stretch, and it was because I was hunched over. So my breast friend really helps with that because it kind of forces you to bring your shoulders back and lift your torso up, and then you've got the support underneath that pillow. You're going to be a lot less fatigued. The other thing that helps with both pillows, this would be a pro, is that by having that pillow there, it provides support for whichever arm is supporting the baby. So for instance, when you're in this position, if you have even a 7.5-pound baby, you can be sitting like this. This part of your arm and your wrist are going to get really tired. And if you're really focused and really trying to make sure that you're doing this just right, you might find that these muscles are getting kind of tense. And after a while, they're going to need to relax. And what can happen is that you have a baby that starts out in a great position and breastfeeding's going well at that feeding. And then as your muscles and your wrists start to fatigue, the baby might slide down. And that means that less of the breast is in the mouth. That means that the nipple, instead of being way back here, way back there by the soft palate, it's going to be up closer to the front of the mouth, which is the hard palate. Now, while you're sitting at home, take your tongue and run it under the roof of your mouth. Feel those ridges? That's your hard palate. Now, if you roll your tongue a little back, you can feel that smooth part. That's your soft palate. You want your nipple to be in the back part of your baby's mouth by the soft palate. The roof of the mouth, the hard palate where we have those ridges are the rocks of doom. Don't put your nipple there. That's one of the biggest causes of nipple pain, and that's why a lot of moms stop breastfeeding, is because it hurts. And this is one of those tweaks that I was referencing, is that if you just tweak and get a little bit more of the breast in the mouth, you're probably going to wind up with your nipple further back towards the soft palate. You're going to be more comfortable. If you're more comfortable, regardless of how you're holding your baby, you're going to relax. You're going to be able to breathe a little more easily. That's going to help with the flow of the milk. Your baby is going to perceive that. Babies are really, they're a mirror of our emotional state. And if we're tense, your baby might mirror that back to you. So it might be a little bit more challenging sometimes to get your baby to latch. So if you've got a good pillow with good support, you've got support for your arm, and you've got your nipple way back in the baby's mouth, you're going to relax, and it's going to be a comfortable feeding, and it's going to be something that you and your baby are going to enjoy. And that's the whole point. We want you guys to enjoy this. We want you to be comfortable with breastfeeding. We want you to feel like you can do it, right? So that's what you want to do. Okay, Cindy, why don't we take a couple questions?
Brittany is a working mom. Can you switch between formula and breastfeeding? She's worried about being able to pump enough for a week. How does that work? Brittany.
Okay, Brittany, why don't we just jump ahead? We've talked about the hold and the latch, and I feel like we've kind of, we've covered that sufficiently. So let's talk about when you guys go back to work. For both of my babies, for my first two, I had to go back to work. With my second, I was back at work right at the end of the holiday season, and I was trying to pump, and he was also at daycare with his big sister, and it wasn't going so well. Remember, I wasn't in a very supportive environment, and when you work retail and you're going back to work at the beginning of Christmas season, you can imagine there just wasn't a lot of time. So the short answer is yes, you can bottle feed and you can pump, but if you're concerned about pumping at work and not having enough time, it depends a little bit on the kind of work schedule you have. In general, if let's say you work 8 to 5, okay, what you want to do is try and breastfeed your baby as late as you can just before you leave for work, and then about 3 hours later, let's say you start at 8, so about 11, maybe you can take your lunch break then, pump on your lunch, but your employer needs to provide you time separate from your lunch break in order to pump. So just remember that. So pump 15 minutes and then put it in a safe storage place. You should have a bag or something where you can store your breast milk. Keep it at least refrigerated. Then maybe 3 hours later, you pump in. And like it's maybe 1 or 2 o'clock. Okay, I see that we've got some static and the audio's in and out. Bear with us. We're thinking it might be the internet connection, so just hang tight. Check again after we finish the class. We're going to post this on the hospital's Facebook page. So if there's anything you missed, or if there was a question that you couldn't quite catch the whole answer to, you'll be able to go back and reference it. So don't worry.
Do you want to answer a question for a second? Or are you still going?
So, well, let me finish this, and then Stephanie, we'll get to your question in just a sec. Okay, Cassidy says her audio sounds good, so some people are getting it. Good. So you're at work, you're going to pump maybe 2 or 3 times. Then you're going to go home. The first thing you're going to do as soon as you get home is put your baby to the breast. All that milk that you pumped when you're at work, you're going to put that in the freezer. But let's go back. Let's go back to maybe a month before you go back to work. What I want you guys to start doing is first thing in the morning, right after that first feeding. Let's say your baby wakes up around 5, okay? And that's usually when your breasts are going to be fullest. Put your baby to the breast, feed them as long as they want. And then as soon as you take the baby off the breast, I want you to pump. Get your electric breast pump, and you should have a dual electric breast pump. So you can do both breasts at the same time. You're going to pump for about 10 to 15 minutes or until you see the flow stop from the milk, but no more than 20 minutes. And then whatever you get, you're going to put that in the freezer, okay? Then do that again the next day. And the rest of the day, you're just breastfeed. So just put your baby to the breast as much as they want, but just after that very first morning feeding, pump and save them. Then the next day, you're going to do the same thing. And then the next day after that, same thing. So now you've got 3 feedings already stashed in your freezer, okay? So maybe on the 3rd, 4th day, let's say you start this on Sunday. So maybe on Wednesday, you sit down and you think, well, you know, the baby takes a longer nap in the afternoon, and I'll feed the baby about 1 o'clock, and I know he's not going to wake up until, 3:30, so I could probably pump then. Go ahead and pump a second time in the afternoon. What we know about breastfeeding hormones is that they reach their peak early in the morning, and then as the day goes on, they start to dip a little bit. So around dinner time, evening, that's when they're hitting their lowest levels. And then as you go to bed and you sleep and the night goes on, then your hormone levels are going to go up again, and they'll be high again around 5, 6 o'clock in the morning. So what you want to do to increase the level of your hormones is you want to breastfeed or you want to pump. So if you pump in the afternoon, you're going to help keep that slump from not dipping so low. Maybe instead of down here, it'll be just here, okay? That's also going to protect your supply, and then it's kind of conditioning your body to get used to the demand happening around that time, so that when you go back to work, your body's kind of already going to be in sync with that. So for the first month, you're going to breastfeed and then pump after the first feeding, and then maybe once more in the afternoon, and do that for a few weeks. So by the time you go back to work a month later, you should have a nice stash. Your body's conditioned to the pumping process as well as the baby being at the breast, and hopefully you won't have issues with supply. I hope that answers your question. Let's answer another question.
Yes, can we get a shout out for Miguel's cousin who's watching?
Oh, hi Vicki. Hi Vicki. Miguel, that's your cousin. How you doing? Thanks for joining us.
In a couple weeks.
Oh my gosh, 2 more weeks. Can you stand it? Are you all done being pregnant? I know I was. I was all done. I was ready to be done. Are you going to have your baby here, I hope? If you do, I might take care of you.
So, Stephanie, how do you know your baby is getting enough milk per feeding? Is it usually 1 breast per feeding until they fall asleep?
Okay, Stephanie wants to know, how do you know if your baby's getting enough? And that's very timely. That's the next topic I was going to hit. How do you know? Well, it'd be really nice if we had little, like on those bottles, they have the little markers that show you how many mLs. Yeah, we didn't get that. So what you're going to do instead is watch your baby's output. And by that I mean your pee and poop diapers. By the time your baby's approximately 5 days old, they should make about 5 or 6 diapers every 24 hours, and roughly 3 or 4 poops. Some poop more, some babies poop a little less. In the first few days, you want 1 wet diaper and 1 poop diaper for every day of life. So first 24 hours, 1 wet, 1 poop. Second 24 hours, 2 wet, 2 poop. Third 24 hours, you want 3 wet, 3 poop, and so on and so on. So by the time your baby's a week old, you want to see 5 or 6 nice heavy wet diapers every day, and average 3 or 4 poops. Okay, we're having some people that are still saying the audio's in and out, Miguel. So we're going to keep working on that. Bear with us, folks. Like I said, if you're not catching everything, be sure and check the hospital's main Facebook page in just a little while. We're recording this, and we're going to post the whole session up there. So whatever you miss live, you'll be able to catch it in a little bit, okay?
Do you want to answer one more?
Yeah, let's another question.
Chanel, she would like to know, do breastfed babies spit up more?
Chanel wants to know if breastfed babies spit up more. Not necessarily, but maybe. Spitting up is really kind of a general thing, and it's kind of unique to each baby. I think we're more aware of bottle-fed babies spitting up because it tends to not smell so good. You know, we're more aware of it that way. Breastfed babies spit up, but I wouldn't say necessarily more than a bottle-fed baby. Part of our education when you deliver here and we get you ready to go home, we talk about that. When your baby spits up, it looks like it's the whole feeding that's coming up, and I'm talking like, think of like a bottle that's like, you know, a decent sized bottle of perfume. If it's that much coming up, that's not good. You want to talk to the pediatrician about that. The other time that we get concerned about spit up is if it's coming up with a lot of force, enough force for it to shoot out of the baby's mouth and potentially splat on the wall. Now, would it actually splat on the wall? Probably not. But we shouldn't see spit up come with that much force. So if that's happening, that's another time when you want to call your pediatrician, okay? But in general, spit up happens to everybody, but if it seems to be happening a lot or you're concerned, the best thing to do is just to talk to your pediatrician. And that's kind of the default answer for a lot of the questions that we have when we bring our babies home. What about this? What about that? Well, if you're not sure, it's always okay to check with your pediatrician. If you don't feel like it's an emergency, maybe you could just give a phone call. I don't think any pediatrician in town would want a parent to sit home and just stress and be anxious. But on the other hand, I don't think that they want 11 bajillion phone calls in the middle of the night either. So of course, you know, you're gonna know when it's an emergency or when it's just maybe something. Hey, you know, hey mom, this is happening. Is this normal? Or you can call the unit. You can talk with your nurse before you go home for sure. Ask your friends. You know, hey, is this happening to you guys? I'm not sure if this is normal or not. And there's tons of breastfeeding support groups out there as well as online. We have one here at the hospital, which our lactation consultant Debbie runs. We meet on Wednesdays when we're through with the virus issue. We meet right here in this classroom. It's on the second floor of the hospital, so the same floor where you deliver your baby if this is where you come. And we meet on Wednesdays from 11 to 12:30. When you come to support group, we're going to weigh your baby before and after a feeding. You get a rough estimate of what your baby was able to take in during that feeding. You're going to be in a really relaxed environment, so you're going to be able to just chill, relax. It's just mom's breastfeeding, so you're going to be with your compadres. Even if you don't have any questions and you don't feel like you're really struggling, it's a nice time to get out of the house. And it's not a bad idea. It kind of helps you to practice breastfeeding in public if that's something that's concerning for you, like, I'm going to have to go to the store, and I know my baby's going to want to eat, or I'm going to go out to dinner, you know, because eventually, please, God, soon I hope, these restaurants are going to open up and we're going to be able to get out and socialize and go and hang out with our friends and be at their homes, and we're going to want to do these things. Well, you've still got a baby that's going to need to eat, right? So if you're more on the modest side, a breastfeeding support group, a live breastfeeding support group, can be a great place to practice that. And we can talk about things to do to help kind of overcome the little bit of anxiety that you might be feeling. Okay, I'm just about finished. I want to wind up and touch on a few other points, and then we're just a little bit past noon, but I don't have anything else to do today, guys, so I'm going to stay and answer as many questions as I can, but I think we'll try and wind it up maybe about by 12:30 or so. All right, so we touched on sore nipples just a little bit. It's happening while you're in the hospital. The first thing I want you to do is press that nurse call light. Can you please tell my nurse I need some help with breastfeeding? That's what I want you to do. That's why I am here. You're not bothering me. And I can speak comfortably for my coworkers, especially in postpartum. We are here to help you. And our purpose is to make sure that when you go home after you've had your baby, that you feel comfortable and relatively safe doing that. Now, are you going to be able to know everything? No. When you leave and go through the main exit, there is no matrix download for parenting. So don't hold your breath for that. It's very much on-the-job training. But our job while you're here with us is to make sure that you have time to bond with your baby, that you've established that breastfeeding relationship, and that you feel confident enough to go home and do it on your own. And you are going to be able to do it. You guys are so much more competent than what you're giving yourselves credit for, especially you first-timers. You think you don't know because you've never done this before. Trust me, you're going to do it. You're going to do fine. You will. And that's part of our job here, is to make sure that you feel that way, at least a little bit, when you go home, okay? Just to come and hold the babies and take their temperature, you know, and do the little tests and send you home. Part of our job is to be bothered. So if it's 2 o'clock in the morning or 4 in the afternoon and you have a question, I don't want you to sit in your room and, oh, gosh, Amy was just here half an hour ago and I feel like I asked her that question already, but I can't remember what she said. I'll just do it on my own. I'll just be okay. I don't want to bug her. That's why I get paid the big bucks, okay? Not that they're big, but that's why I'm being paid. I'm being paid to come and take care of you guys and help answer your questions. So I hope I've beat that horse. I hope it's dead, okay? Call your nurse if you have trouble with breastfeeding or any other concern. Call for your nurse. A lot of moms will experience engorgement, and it's a temporary condition, and that happens just as a result of the transition that's happening within your breast anatomy. A lot of what it is, it's just an inflammatory process, and it's temporary. You should have either prescription, or your doctor will tell you to take some over-the-counter ibuprofen when you get home. Though that's going to be one of the best things for you. Engorgement just means that there's a lot of blood flow to this part of the body because there's a lot going on. And whenever you have increased blood flow to the body, a lot of times inflammation can come with that, and that makes it uncomfortable. Your breast will kind of hot and kind of tender, especially on the sides. So be sure that you get some ice. Put it right up along the sides wherever it's tender and uncomfortable for about 20 minutes or so after a feeding. And then just keep plugging away with breastfeeding. That engorgement will go away. Call us if you have any difficulties. Debbie, I see your comment. Thank you so much. Debbie, this is one of her big things. Whenever we teach the class, whenever she and I teach the class, one of the things we talk about is getting your breast pump. If you are 36 weeks or more or less, if you've got 4 weeks or more before you deliver, I want you guys to call your insurance companies now. Find out if you get a free breast pump, and if you do, now is the time to order it. You want that at your home, ready to go before you have your baby. Thank you, Debbie. Thank you for reminding me about that. I probably would have remembered it when I got home, so thank you. I'm glad you're watching. All right. Another thing you can do to help with the engorgement is just a little bit of gentle massage. What you're going to do is kind of lay back in a chair or in your bed, and you're just going to put this arm above your head, kind of in the same position that you would use to do a breast self-exam. You're just going to take the flat of your hand and your fingers, and you're just going to gently massage in an upward motion toward your armpit. That's where you have a lot of lymph nodes, and that will encourage the drainage of the lymphatic fluid, and that can sometimes help alleviate the engorgement discomfort. Mastitis is another thing that we talk about. That's an infection within the breast tissue, and it happens when babies aren't fed often enough, when the breast isn't being emptied. So, and this is part of your postpartum education when you go home, but things to watch for would be a really full, swollen breast, or it could be both sides. Really full, really swollen, skin stretched really tight. It can feel like it's skin stretched over some rocks, and your breast tissue can be really hard. It's very tender. You might see a red spot on your breast, or you might see little red streaks that follow the vein pattern on your breast. If any of those things are happening and you have a fever 100.4 or greater, and you feel like maybe you're getting the flu, you just don't feel good, first thing you're going to do is call your OB. or whoever it is you're seeing, whoever is taking care of you during the pregnancy, they're going to follow you for the next 6 weeks after you deliver. So you want to call your doctor and say, hey, this is what's going on. The thing you need to do is be seen. You need to get on some antibiotics right away, and you need to be sure that whatever side is affected, that you continue to, if not feed, you want to pump still on that side, because although it's uncomfortable, you want to maintain the supply on that side, so you want to keep things flowing. The last thing you want to do is stop doing anything to the affected breast. That's just going to increase the infection. It's going to take longer for you to heal up, okay? So be sure you're at minimum pumping on the affected side and continue to put the baby on the other side. Now, if it's comfortable enough for you to breastfeed on both, that's great. The antibiotics and the infection aren't going to bother the baby, so just continue to breastfeed on both sides, okay? Let's see. In general, we're getting toward the end, and we're going to have lots of time for questions. I'm almost finished. So when you're in the hospital, in a normal time of year, we see a lot of visitors come through, and this is something that I talk about in the class. When you have a baby, especially when it's your first baby, but with any baby, you're never going to get those back. You're never going to get that time back, and I really encourage people to limit, if not just prohibit, visitors. Now, right now, we're kind of doing that for you, but even when you go home, for that first two weeks or so, try and just have it. You want to give yourselves that time. Give yourselves the luxury of being able to get to know your newborn. And my mom will appreciate this. My grandma, my mom's mother, told me once on the phone, it's going to make me cry a little bit, when I had my third baby, it was a really busy time. And I remember talking to her and saying, gosh, the other two kids, they're so busy, they're running around, and I was trying to potty train one and trying to keep the other one out of mischief, and then I had this new baby, and I was just kind of frustrated, and I was tired, I'm sure, and Gramsci said to me, oh, honey, those babies, they're so little for just a little while. And I want to tell you guys that too. You're not going to get that time back. So just soak up all the time that you've got with your babies here in the hospital, but when you go home too. And if it's a new sibling that you're adding to your family, just incorporate that baby into your already existing family unit and just enjoy that time. Now, exhausting? Yeah. But like I said, you're not going to get the time back, and you're never going to be sorry for spending that extra time. No one, I haven't heard of a mom that's gone to work that has said, oh, I'm so glad to get back to work. Nobody's ever said that. It's a lot more, oh, I wish I was at home. I wish I could be with my baby. Some moms, they have to work. Some moms, it's just part of who they are, and they want to work, and I applaud them. That's wonderful that they're able to do that. Not everybody can, but nobody ever says, I'm so glad to leave this baby home and go back to work. So soak up that time. And while you're in your postpartum period for the first 6 weeks after you deliver, moms, that's not the time to be adding a lot of things to your new social schedule, to your new social calendar. And again, we're in different times right now, so we're kind of forced to just kind of hang out at home with our babies. This is a really unique, special time for you guys, so maximize that. Be sure that you're getting outside every day. Take a little walk. I know this week in Vegas, we're getting heat warnings every day. So right now at 12:15 might not be the best time to go outside, but 9 o'clock, that might be a good time to go out, walk around for a little bit, get a little fresh air, get a little exercise, nothing strenuous. We don't want you lifting anything heavy. We don't want you to push anything heavy, but a walk, 10-15 minutes in the morning, and maybe in the evening after the baby has the dinner time feeding, maybe 6-7 o'clock, take a little stroll around the block in your neighborhood. Get outside and get some fresh air and just move your body a little bit, okay? It's real important that you take a little time each day for yourself, because you were you, all just you, before you became a mom. So it's important that you honor that part of yourself too. whether that means just taking a few minutes and listening to a little bit of your favorite music, or reading a book that you set aside months ago. Pick it up, start it back up again. Take 10-15 minutes for yourself. You're going to be a better mother for it, and your baby is going to do really well, because the most important thing for a baby to have is a happy parent, happy mom, happy dad. And the way that we are happy is to take care of ourselves. So I know there's a lot of talk on social media about self-care. Listen to it. Find the things that are meaningful to you, that you respond to, and incorporate those just into your daily routine. You're going to be better for it, I promise you. What else? We talked about pumping and going back to work already. We talked about our support group. Okay. Your vitamins. Everybody should be taking a prenatal vitamin right now. You want to keep taking the prenatal vitamin until you're all done breastfeeding. And the reason is your body needs that extra nutritional support. You are a milk factory right now. And what your body's going to do, if you're not putting enough of those nutrients back into your body is, your milk ducts are going to say, okay, we need some more calcium right now. We're going to just pull it from the bones. It's okay. So that's why it's really important you're getting your vitamins and your minerals every day. So be sure that you continue to take your prenatal until you're all done breastfeeding, and then you'll resume that when you choose to get pregnant again. You want to be sure that you have a really supportive, well-fitting nursing bra. There are so many out there, so many to choose from, and I know we can't go to stores right now and try them on, but there's plenty of tools online that will allow you to do the measurements so that you can order the bra online that's going to hopefully work best for you, and hopefully you'll only have to order once. But it's really important that you have something that's well-fitting, that's supportive, okay? And if you can, we'd like for you to avoid using the bras that have the underwire here. Sometimes the tips right up here can end up against a milk duct, and you can create a clogged milk duct, okay? I'm going to get a sip of water. Okay, we talked about bras. I think most people know that smoking is not a healthy habit. When you have a newborn, secondhand smoke is very dangerous because you've got brand new lungs, and we don't want to damage those any more than the environment already has the potential to. So if there's anybody in your circle, either in your family or in your social circle, once we start mingling again, if they are a smoker, not at your house, not in your backyard. I would not recommend that either. If they've been someplace, if they've had a cigarette and then they're coming to visit you, ideally, we want them to put on a different shirt, something to cover, because there's still remnants of that secondhand smoke in the clothing, and you don't want to transfer that to the baby. Okay? That's pretty much it. Let me just make sure that I didn't miss anything. I think that's pretty much all the material I had. Now, the real-time class, we would offer, there's a 20-minute period where we'd show a video, a portion of the video from Dr. Jack Newman that I talked about at the beginning of the class. So the time when we would, watch the video, we'd have a potty break. I'm hoping that you guys have taken your potty breaks as you needed to. But right now, for the next probably 10-15 minutes, Cindy, why don't we open it up to any questions that I maybe haven't already addressed?
We have a lot.
Okay,
So,
hit me.
let me get to, sorry, we have a lot, so I'm rolling back up to the top.
Okay.
Okay, so Claudia is a nurse, and she's asking for tips. She wants a good routine for nurses and breastfeeding and pumping. She works night shift. She's a nurse.
Oh, hi, Claudia. What do you do? I'm going to try and talk to you about a good routine for when you're at work and pumping. So be sure before you deliver, you've had a talk with your charge nurse, with your unit director, so they know what your goals are, what your plans are, and talk about how a pumping routine can fit in with the routine and the flow on your unit, okay? So what I would, and we have moms here at Southern Hills that work on various units as nurses, physical therapists, all different places. And when we're not dealing with the virus, we do have a space on our floor where moms can come and pump. And it's just set aside for that. So that's something you want to have a conversation with your charge nurse and with your director now before you deliver. Let them know what your goals are, what you want to do, and then with them work out a schedule that's going to work best for you. But ideally, if you can, you want to try and get away from the unit about every 3 hours or so and pump for about 15 or 20 minutes. So I don't know what that's going to look like on your unit, and I don't know what the flow is, how busy your unit is. I also don't know about your patient population. That may have another, that another piece to it. So now's the time to have a conversation with your charge nurse and your director. Let them know what you want, and then the three of you guys work out a plan. But that's what I would do, and then try and pump every 3 hours. When you leave the hospital, you won't need the formula that comes in the formula bags, but you can ask for the bag. We'll take the formula out because the ones that we have are insulated, and that's a great place to put your pumped milk so that it's not just sitting out in the break room, refrigerator, right? So that's a good thing to use, transport your milk to and from work as well. Hope that answers your question. Okay, Cindy, what's our next question?
Angie would like some tips on breastfeeding when she has a toddler that she's chasing around as well.
Oh, Angie, I've been there, done that. I've had an 18-month-old and been trying to breastfeed and had a 4-year-old and a 3-year-old and a newborn that I breastfeed. It can be challenging. What worked for me during the day when my older kids were up and moving around was I made sure to have a few things, a few maybe special toys, activity books. Now, this is the time before all the electronic gadgets and stuff, so we didn't do that stuff. But I had special toys that we just brought out when I was sitting down. That's a good time to read a story too. You can incorporate that into the routine. There were a couple of really fun shows on PBS that my daughter especially liked to watch, and I could most of the time get my older son to sit down and watch, but as long as he had toys nearby and I was in the same room, and you just lay the ground rules. This is what we're going to do right now. Mommy's going to sit down and feed the baby. Now you guys get to watch whatever the show is, or maybe that can be the time when they get to use their electronics. But something quiet that they can do that isn't going to involve a lot of moving around, and then get them busy doing that, and that'll give you maybe 15-20 minutes time. Hope that helps you. Okay, next question.
Can you repeat the question so everyone can hear?
Oh, sorry. So that response was, what do you do? The question that I was just addressing was, what do you do when you have a toddler at home and you're trying to breastfeed and wrangle the big kids that are running around?
Okay, so Jocelyn says, if you work a graveyard shift, does your milk output change to your body clock or keep to what it was when you were on a normal schedule?
So Jackie's wondering Jocelyn is wondering if you do shift work, if you work at night, if that can make a change to your supply. I haven't heard anything about that. Debbie, if you're still online, if you know something specific, if you want to just type in a response, that'd be awesome. I personally haven't heard that working days versus nights can have a positive or a negative effect on your supply. What I do know is that breastfeeding is all about supply and demand. As you increase the demand, the supply goes up. If the demand drops, in other words, if the baby's not eating as much, or if you're not pumping to make up the time when the baby would be at the breast, then your supply is going to lower to meet the new demand level. Now, when your baby's about 6 months old, your pediatrician is probably going to tell you that that's when you can start incorporating solids. And you're going to see a natural decrease in your supply. The baby's not demanding as much because they're getting solid foods. That's normal, and a lot of moms can get concerned about that because they had so much milk before and now they don't have as much. Well, it's part of the process. Hope that answers your question, Jocelyn. Okay, next question.
Cherise says, my son is in NICU. I am pumping. How can I switch him from bottle to breast?
Oh, Sharice, been there, done that. Been there, done that. So Sharice's baby is in the NICU right now, and she's wondering how she can transition from pumping to putting the baby on the breast. And what I would suggest you do is try and start that process before your baby goes home. So by the time your baby is to be discharged, you've already established that breastfeeding relationship in the hospital, and with luck, there's a lactation counselor or a lactation consultant there that can come and help you and work with you one-on-one for a couple of feedings. But that's what I would encourage you to do. That's what helped me a lot. I was able to put my baby to the breast before she went to the hospital. So by the time she did go home, when she was 2 weeks old, I was pretty comfortable with it, and I had a pretty good idea of what to do. So that's what I would suggest you do.
Emily has a question for you. Emily says, although we can all agree breast milk is best due to COVID-19 and the stockpiling going on, do you recommend us buying formula in advance in case there's some sort of an issue we have with breastfeeding the baby's intake? If yes, do you have a kind of formula you think is best?
Okay, Emily's wondering, well, first, yeah, you're right, Emily. Breastfeeding is the best way to feed your baby, but with the current state of our country and the world as far as the COVID virus is concerned, she's wondering if we wouldn't want you guys to start, ordering formula now because some people might be stockpiling. And I wouldn't really encourage that. And the reason why is because not so much that I would be concerned about you feeding your baby, but what I think that's speaking to is a fear that I had, and I think a lot of moms have, that what if I don't have enough? What am I going to do? What if this? What if that? What if that? You can spin those what ifs in your mind for days and days and days, and if you let it, it can really make you nuts. What I would suggest you do instead of worrying about what if there isn't enough, and maybe I should have this just in case, what I would focus on is maybe some more positive self-talk. It's maybe going to be hard at first, it might be a little challenging, or I might do really well with breastfeeding, but I'm going to have enough milk for my baby. Now, when your baby's born, and this is something we didn't talk about earlier, when your baby's born, there are certain situations from a medical perspective when it is appropriate to supplement with formula. We have enough here at the hospital to do that. So if that becomes an issue, let's cross that bridge when we come to it, okay? What I want you guys to do is to come into the hospital with the plan that I'm going to exclusively breastfeed, and then if something medically comes up, for instance, if your baby's having trouble maintaining their blood sugars, that would be an instance where we would need to supplement. If your baby's becoming jaundiced, that's another medically indicated reason for supplementation. And we would talk with you about that. And whenever you supplement, you always want to incorporate a pump, because whenever you're not feeding the baby at the breast, or whenever you introduce a different feeding method, you risk lack of stimulation to your milk ducts. So let's say I have a patient that it's 12:30. Let's say she delivered baby 10 o'clock last night. Okay, so baby's 12, 14 hours old-ish. And let's say the mom was a gestational diabetic. So, and let's say she was just controlling her blood sugars with her diet. She was counting her carbs and making sure she was getting enough protein and things like that. So no meds for mom, but we're going to be checking her baby blood sugars for 12 to 24 hours after delivery. And let's say we've had trouble keeping those blood sugars of a certain threshold that we have set. So we're going to talk with you about that. We're going to let you know that we need to feed this baby more. First thing I'm going to have you do is start pumping. We want to increase the stimulation to the milk ducts, because if a baby's got low blood sugars, for example, they're not going to have enough energy necessarily to feed well at the breast. So you want to be sure with the pump that you're ensuring appropriate stimulation of your milk ducts. And we want to have you doing about every 3 hours so that we can protect your supply. We will probably need to supplement with a little bit of formula, and that would be very short term. It's just really to cover until your mature breast milk comes in. Babies that have low blood sugars can go downhill quickly, and we don't want your baby to have to spend time in the NICU if it's not absolutely necessary. So a little bit of supplementation in the short term isn't going to detrimentally affect your breast milk supply, provided you're doing your part by putting the baby to the breast, pumping, and then let's not forget skin to skin. Skin to skin, we talked about that earlier, and that's really helpful for a baby having struggles with blood sugars. So I'm hoping that I answered that question. It felt like I kind of chased a couple rabbits there, but I'm hoping that was beneficial for everybody. Any other questions, Cindy? Okay, let's answer a few more questions.
Carrie Ann is wondering, is there a natural way for her to increase supply?
Yes, Carrie Ann, there is a natural way for you to increase your supply, and I'm not talking about foods or supplements, which reminds me, we need to talk about one other thing. The way to increase your supply is to increase the demand. So if I have a mom, let's say she's coming to support dealing with supply, one of the first things Debbie's going to tell her or ask her about is how often are you putting the baby to the breast? What are those things like? And how many wet and poopy diapers is the baby having every day? So what you want to do is make sure that you're stimulating your milk ducts enough. If your baby's getting to the breast 8 times, but you don't feel like you have enough, or your doctor or the pediatrician is concerned, first thing we want you to do is to add in a couple of power pumping sessions. And there's a couple of ways that you can do that. So I want to give you guys a minute. I'll try and maybe have, it's kind of lengthy, but it'll help. I'll try and get Cindy to type it out and put it on in the comments. But if you guys have paper, or if you want to get your phones out and start taking a note, this is what I want you to do. Power pumping method number 1. What you're going to do is let's say starting tomorrow morning. Tomorrow is Wednesday. Tomorrow's Wednesday. Okay, so let's say I'm having a mom, she's going to start this process tomorrow morning. So she's going to feed her baby at 6 a.m., about 3 hours later, she's going to feed her baby again around 9. So in the afternoon, what I want this mom to do is for 1 hour, she's going to pump for 10 minutes and then take a break for 10 minutes. And then pump for 10 minutes, take a break for 10 minutes, and then pump once more. So you're essentially pumping a massive amount of times in a short period of time. And then I want you to do that every day at roughly the same time until you see an increase in your supply. And some moms will maybe do it for a couple days and, oh, well, it's not working. Okay, well, that's not working. They give up. You got to stick with it. Okay, sometimes it takes your body a couple of days to get with the program and to catch up with the new demand. So that power pumping method you want to do for at least 3 or 4 days, or until you see a significant increase in your supply. Okay, let me get a sip of water. That's okay. The other method is less time, but it takes up a little more of your time, but it's a shorter period of time overall before you see results. In the evening, anytime after 5, feed your baby, and then if that's the time when you sit down and catch up on Netflix, or there's a couple of shows that you like to watch, I want you just to get your pump, watch TV. Every time there's a commercial, pump. And then when the program comes back on, stop your pump. Commercials back on, pump. So you're going to be pumping for maybe 3 to 5 minutes at a time, and you're going to do this for a 2-hour period for 2 days. So let's say you're going to do it tonight. So tonight, you're going to start at 5, from 5 p.m. until 7 p.m., watch TV, and every time there's a commercial, or if you're watching Netflix, if there's a scene break, you can kind of tell when it goes. If you're watching, I don't know, Outlander or something like that, you're watching for a little bit, which may not be the best show to watch right now, I don't know. Whatever show you're watching, let's say House Hunters, when they take a break and they go from looking at this house and then they're going to go look at the next house, that's a time, just pause Netflix, pause the video, and pump for about 3 minutes. Just set a timer on your phone. And then when the 3 minutes are up, turn the pump off and resume the show. And then when they take another scene break, or they switch from, or if you're on Hulu, going to be breaks. They incorporate some commercials into those shows. So whenever those commercials come up, you can pump. Just do it for 2 hours, and then you're going to do it again tomorrow night. Same thing. That can help increase your supply too. If after the second night you're not seeing the results that you'd like, just keep doing it. Or you can switch to the other method. Just power pump for 10 minutes on and 10 minutes off for 1 hour, and do that too. Whatever works better for you. If you've got more than one child, the 1 hour a day when everybody's taking a nap, that might be the time for you to do that. So maybe 3 o'clock in the afternoon, that might be a good time for you to do the 10 on, 10 off plan, and then you would just need to do it for a few more days. But if you've only got one baby, or your other children are big enough that they're independent and they can go and entertain themselves for 2 hours, and you don't need to have your finger, or your eyes on them at all times, then the 2 hours in the evening for maybe 2 or 3 nights, that might work better for you. Try them out. Think about your family and what your family dynamic is like, and then just pick the method that works for you and then stick with it until you see results. Hope that answers your question. Sorry that I feel like I'm taking a long time to answer the questions, but I want to be sure you guys have the information. Okay, let's go to the next question, Cindy. Mastitis. Okay, lots of people asking about mastitis. Debbie, if you're still watching, I want you to chime in too. Put something in the comments if you feel like I'm missing something. Mastitis is an infection that happens in your breast, and it happens because moms aren't stimulating the breasts enough. In other words, they're not feeding the baby at the breast enough. Sometimes moms who are doing both breast and bottle can run into this problem. If that's what you're choosing to do, that is totally fine. It doesn't matter if you're breastfeeding, how you get the infection or the circumstances that lead to the infection aren't as important as getting it treated. So once you notice those symptoms, I'll go over them again, and then Cindy, if you want to put those in the comments. So these are the symptoms that you want to watch for with mastitis. A red spot on the breast that's painful, or red streaks that follow the vein pattern on your breast, a fever of 100.4 or greater, and increased pain in general at the affected breast. If you're experiencing those symptoms, the first thing you need to do, call your OB right away. Let them know what's going on. And in this time, it might be just a telemed appointment. They will probably want to look at the breast just so they can to give the proper diagnosis, so maybe prepare that. But if you're experiencing that, you want to be sure that you get your OB involved right away. And then that's a prescription that can be phoned into your pharmacy. But you need to get on those antibiotics to treat the infection ASAP. Because the sooner you start, the sooner you're going to feel better. I hope that answers everybody's questions about mastitis. I want to let you guys know too, if there's a question that is really weighing on your mind, but maybe this particular format is not comfortable for you, I want you to know that you can send a private message on the Southern Hills Facebook page, and it will be routed back either to me or to Debbie, and between the two of us we should be able to answer your questions. So I don't want you to feel that if you're not comfortable in this forum that you're not going to get your question answered, okay? So if there's something unique to your situation and you really want to know but you're not comfortable asking, just send a private message and we'll take care of it that way, okay?
So it's 12:40. How many more questions would you like? We have a bunch.
Okay. Well, it's about 12:40. I mean, I can keep going for a little bit longer. I don't want to keep you guys here, wrapped up at your laptops all day. I'm happy to answer questions. I love to be able to teach and do that. So let's take a few more questions. Let's go for about 10 more minutes, okay? Because that'll be 2 hours.
Keely or Kelly has asked this a few times. Keely is first-time mom.
Okay.
She's being induced at 39 weeks tonight. She's saying, will I produce colostrum
Okay. So, Keely, I'm hoping that we're saying your name correctly. If it's not Kelly, I apologize. I've one of those names that can be tricky to pronounce too. So she's wondering, she's coming in tonight to be induced. Congratulations. But she's not leaking yet, and she's wondering, this is her first baby, is she going to have enough colostrum? Chances are, yes, she will. Most moms are leaking at some point. You might be, and maybe just not very much. So if that's something you're concerned about, I want you to talk to your nurses about that. Know what your concerns are. It might be that, we get a hospital-grade breast pump into your room just to make sure that your milk ducts are being stimulated sufficiently. But you don't necessarily have to be leaking and dripping to have a good, successful breastfeeding relationship. So don't worry too much about that. Right now, I want you to focus on getting some rest and getting ready to have a healthy baby. Okay? Congratulations to you.
Angeli says, do you recommend both a nursing bra and a pump bra? Than the other?
Okay, Angeli wants to know if I recommend a nursing bra or a pumping bra, and is one more beneficial than the other. So if I'm understanding your question correctly, they do two different things. So a nursing bra just has the flaps. A pumping bra isn't necessarily made for breastfeeding. It's made to accommodate the parts of a breast pump so that moms can breast pump hands-free, which I think is a fantastic thing. But do you have to buy a pumping bra? No. If you want to, go for it. You can. But they can be a little spendy. Excuse me. What you can do instead is to take your least favorite bra or your least expensive bra, the one we can throw out. Hang on to it, and what I want you to do is take the flange part, or the shield, some people call it, of your pump. It's the part that fits up here against your breast, and then there's a little cylinder that comes out from that. So take that cylinder, and you want to put it right over the cup of the bra, draw a circle, and then cut out that circle. And then what you can do is put on the old bra, get it in place, and then you can put the shield inside, and the cylinder part will come out, and you still have a pumping bra, but you haven't spent $50. That being said, if someone is generous enough to purchase one for you, please use it. I think they're fantastic. An actual nursing bra is meant to just assist with breastfeeding. It doesn't really help keep the flanges or the shields of the pump in place. So they kind of do different things. Hope that answers your question. Okay, let's go on to the next one.
Emily is our class at Southern Hills.
Hi, Emily.
She heard we can pump during our shift on the women's services floor. She's wondering, but now it's moved, so she's wondering where she can pump at work.
So Emily, we have sign at work, and the new Emily's a nurse that works at Southern Hills, but not on my side there. We do have a pumping room for moms, and when we're not dealing with the virus, yes, it is on the second floor. But for now, it is it's on the first floor, and it is behind the waiting area in admitting, I think. I see the sign every day, but I never pay attention to it because I'm not pumping. But if you come up to the second floor, you'll see signs before you walk in. And if you're not sure, just call and ask us. 916-6600 is the main desk number. Just call and we can let you know. Okay. Sorry, I don't have that location right at the tip of my tongue, but yes, we have one.
Madison would like to know if we bring our own pump to the hospital.
Hi, Madison. She's wondering if you guys should bring your own pump to the hospital. I would say no. The pumps that we have are hospital-grade breast pumps, and they are here for you to use. The pumps that you have at home are for consumer use at home. They're not quite as they're not as industrial strength, I guess is what I want to say, is the hospital pumps. So have your pump ready to go at home. Take it out of the box, play around with the parts, and get comfortable with it. So when you do go home with your baby, you know what to do. But in general, you don't need to bring your pump with you to the hospital unless you're really not sure what to do with it and you want us to help you with it. And if that's the case, of course, yeah, Bring it and we'll help you. We'll show you how to put it together. And Debbie's really familiar with the other brands of pumps. I'm really comfortable with the Medela because that's what I used, and that's the kind we have here. But maybe you've got a Spectra or an Amita pump. Bring that with you, and either Debbie or myself can help you figure out how to use it, okay? All right, next question.
So we're at about 12:45.
Mm-hmm.
So I do recommend having your baby at Southern Hills Hospital.
Okay.
That's the final one.
Okay, so we're at 12:45, and we're going to wind it up with this last question. And the question is, why would I recommend having your baby at Southern Hills Hospital? There's a lot of reasons. When I was having my babies, I wished that I could have delivered in such a supportive environment. I really think we do a great job at all aspects of women's services. From the time you walk through the door, we have the friendliest unit clerks that are there to greet you and help you get comfortable and ease you through that first little bit. And sometimes that can be a little scary when you come in and you're contracting and you can hardly breathe and you're kind of freaking out because oh my gosh, what do I do? Anna and Yvette, Helen, all the others, they're wonderful. They will help you feel so comfortable and they'll set you at ease a little bit. When you get down to labor and delivery, we have, I think, the best nurses in labor and delivery. If I were having a baby now, and even if I didn't work here, I would want to have my baby with those girls because they are some of the most caring and kind and compassionate women that I have the pleasure of working with. And I can't tell you the number of times that I call them repeat customers. We have women that have had their first baby here, and then for whatever reason they either chose this hospital or maybe their doctor only delivers here and so they have to deliver here, but they come back again and again and they request, is Pam working today? Can Pam be my nurse? Is Kayleen working today? Can she be my nurse? Is Robin here? Robin took care of me last time. You know, we hear those comments all the time. And I think that's the mark of a good hospital, when you have patients that keep coming back and they keep asking for those same nurses. And I would be thrilled if any of those women helped me delivery. And then, of course, you know, postpartum is my unit, so I have wonderful coworkers on my unit. I would be so thrilled if I could come here and have the kind of support and the level of teaching that we give here. Postpartum is different than labor and delivery. Labor and delivery, they want to make sure that the process goes well, and we have a good outcome, that we have a healthy mom and a healthy baby and a healthy intact family unit, right? So then when you come to postpartum, I describe it as a lot more teaching heavy, and I really think we do the best job at that. I hear comments all the time about my coworkers on day shift and about my coworkers on night shift. They love the kind of care that we have, and if I were choosing, I'd come here. Now this is just a little thing. I know that some hospitals, maybe most of them, we give you a celebration lunch. We've got a battery here on the laptop, Miguel. I know that you'll get a celebration lunch, probably some kind of a treat when you have your baby. We do the best job here. We give you a choice of 4 entrees, and I know it's a little thing, but you know, sometimes it's those little things that make a big difference. You get a choice of 4 different entrees, you get a wonderful cake, you get a full-size bottle of Martinelli sparkling cider. It's so good. And when it was developed, it took about 9 months, so it was that chef's baby, literally. And I'm so proud when we get to bring that into the rooms, and it's the parents are so thrilled that, oh my gosh, you guys did all this just for us? Mm-hmm. Because we love our patients, and I think I work with a bunch of really committed, really devoted, and loving people, and I wouldn't want to have my baby anywhere else. When the time comes for my daughter to have a baby, hope it's not too soon, but when that time comes, I want her to come here too. Not just because I work here, but because I want these girls to take care of my baby girl. I'm so glad that you guys all joined us today. It was so nice to see all these wonderful people showing up. Debbie, thank you so much for showing up with us. Thank you everybody for participating. And like I said, we're going to post this video on the hospital's Facebook page. So if there's anything you missed, be sure that you check the Southern Hills main Facebook page, and you'll be able to see the video again. And hopefully, if you missed a question or missed the answer to a question, or if your audio was kind of sketchy, hopefully you'll be able to hear it well. Thank you so much, everybody, for joining us. It was my pleasure to be with you today, and I hope to see you soon at Southern Hills. Good luck to everybody.